James Russo and David Evans in the studio. We're talking chiropractic, we're talking osteopathy, and Robert's in Coventry. Hello, Robert.
Good afternoon, Ed. I've had a back problem for about 6 months now, and I've referred it to my doctor, and he sent me to the hospital for x-rays on my spine. And what they found out is I've got disc crushing down onto the bottom of the lumbar part of the spine, and the tissues between the disc are crushing, and they're gradually pushing one disc out, you see. Now, I've had no end of physiotherapy at Walgrave Hospital, but the point is now they've sent me now to Coventry and Warwick Hospital on the Stanley Stanton Road for physio on my back, you see. Now, they've come to the conclusion I've got a new physio. He's given me acupuncture now, and he hopes it might work, but there again, he's referred me to my doctor to go back to Walgrave for a scan. What's the best thing to do with this?
Well, I'll ask both our guests to give you their thoughts. James, do you want to start?
I think a scan is an excellent idea, because the more information they have about what your problem is and what's causing it and the mechanism involved, the more chance they have of addressing the problem. So I think a scan is an excellent idea.
But the problem he described is not uncommon, is it?
No, not uncommon. But the scan would X-ray doesn't really show the soft tissue. So
yes, that's correct. Yes,
the scan will show the soft tissue and the nerves and all the ligaments and the disc material in that.
But what actually the physio said yesterday, he said it's wear and tear in old age. I mean, I'm over 65, but he says it's not unusual for people at my age to have this problem.
No, that's right, Robert. Can I just ask, though, do you have pain down the leg from this?
Sometimes I do, but I've just started one part of acupuncture at the moment. I've got to have 4 sessions of it, actually, to see where it goes from there, you see. Okay. Sometimes it does go down, and sometimes it just goes straight across the back at the lumbar part.
Okay, I mean, because obviously this is always difficult to give you lots of advice if we're not actually able to see you and examine you, but if you get in more pain into the leg and into the buttock area from the back, then the physio is probably along the lines of thinking that the disc problem is now giving you a secondary problem, which is, of course, that it's affecting a nerve. It's either squashing a nerve or just making...
Yes, that's correct. That's right, yes.
Yeah. In which case, the MRI is probably a sensible thing to at least get an idea as to the size of the disc bulge and that sort of thing. So
I'm going to see my doctor tomorrow, actually, to get to go up to Walgrave for a scan. That's what I've been told to do anyway.
That's the next logical step, and
yes,
he sounds quite right to do that.
Because he said on the X-rays it doesn't give enough information, but with the scan it gives you a 3D version of it, doesn't it?
It does, and as James said, it picks up other tissues as well as bone, which the X-ray would have looked at.
But there's no cure for it, really, is there? They can't operate or nothing, can they?
I'd wait to see what the scan says. Depends what they're looking at as to what the next step of treatment's likely to be honest.
Yes, because I've seen a consultant at Walgrave there, and he said it's a very dodgy thing to play about with the spine, because it's not even a 50-50 chance of getting any better.
That's right, and they don't operate unless you really need to have that operation.
Yeah.
Okay, Robert,
thank you very much. Thank you.
Thank you. Just
Bye.
had a message in Team. Could we check this out, please? Listeners just sent me a message to say that there's been an accident on the north side of the M6 after junction 11, and that entry onto the M6 is also closed. And we've already passed that on to travel. Well done. You are so good. You are so good. You must be the second brightest team in the building. Right, moving on. Sue's in Coventry. Hello, Sue.
Hello. I don't know if this has been addressed before in an earlier one, but after 2 years of having really bad back pain, I had some physio which didn't help at all, and I had an MRI scan, and it's been found that I've got arthritis in my upper back. And I just wondered if there's anything that your area could help me with arthritis. I must mention I do have osteopenia as well, but that's not causing me any problems.
David?
Sue, may I be rude and ask how old you are?
I'm 59.
59. What they would say is osteoarthritis when it comes to an X-ray or an MRI is not unusual in someone of your age. Indeed, a lot of the changes that are put down as arthritis are actually nothing more than age changes, so greying hair and that sort of thing would be in the same category. So in a sense, that's nothing to rule out some improvement from treatment, and it's certainly a common sort of thing that James and I would happily treat, and obviously colleagues of ours.
Oh, okay, so it could help me in some way.
Yeah, don't rule it out just because you've been told you've got arthritis.
Okay, great.
Okay.
Thank you for your help.
You're welcome.
Bye.
Taking those calls, 08453 009956. We're here to help. And we've got Ken on the line in Kings Heath. Yes, Ken.
Yeah, good afternoon, gentlemen. I suffered a fall at work in 1998, and since then I've been off work. I'm now being registered disabled, but the problem I have is that I have a pain in the lower back, which then radiates down over both buttocks, the back of my buttocks, down the side of my legs, across the tops of my knees, down the side, outsides of my legs, over to the big toes. And it feels to me as if it's that cold, it's hot, if you know. That's the only way I can describe it. It's such a pain in the legs and the feet. It's so cold that it burns. Now, I had an MRI scan, and what they're saying to me is that there's a possibility that because I compressed the spine in the fall, I may have trapped a sciatic nerve. But I had the MRI scan, and they said there's nothing there that they can see. And they were suggesting to have a decompression operation. Now, if I have a decompression operation on something that they can't see, what is the point of doing that?
James?
Well, I can't comment on that. The surgery is not my field at all. So one thing I would say is that they found that doing MRIs with a person lying down or doing MRIs with a person weight-bearing, standing up or sitting, sometimes shows a different disc involvement, and in the past sometimes the wrong disc has been operated on. So, it's just got to make sure that it's the right one that's being approached.
Yeah, I mean, sorry. I would just, I would just comment, Rob. James, I'll go in first. That the symptoms that you have definitely sound like there's nerve involvement there. The hot, cold, the burning is very what's called neuropathic in nature. The fact that you've got it in both legs is a little unusual from the common presentation, which is one leg at a time for sciatica. So
I mean, when I say both legs, one time for about period of about 5 or 6 weeks is on one leg.
Yeah.
And then I have no problem with it for about a fortnight. Then I get on the other leg. And the other thing that I have noticed, and that my GP is aware of, is that when I have a really bad case of it, without sounding too sort of graphic, I do not know when I'm going to have a bowel movement.
Yeah, that sounds to me like there's definitely some nerve compression going on. When did you have the scan in relation to the pain starting?
I had the accident in '98, and I had the scan in 2002.
2002, and when the bowel movement related stuff, how long since the MRI scan has that been coming on?
That has been on since about 2004-05.
I'd get another scan, to be fair.
Yeah.
I'd get another scan.
The only other thing you may be able to relate to this, when I'm sat down, sometimes the bone in your buttock, it feels like I'm sat on a billiard ball, and the only way I can get any relief, believe it or not, is to go on my hands and knees.
I'd get another scan. I without hesitation, as in, fairly quickly, I'd get another scan for that, because it sounds like something's moved on, maybe more than metaphorically since you've had that scan.
Right. Okay, there, Ken.
Okay, thank you.
Okay, Jane, with you in just a moment. James Russo and David Evans with me. We are talking chiropractic and osteopathy, I'm sorry. Well, it's close. Let's go to Jane in Warbley. Hello, Jane.
Hello. I'm sorry I don't know the gentleman's name. I'm just progressing. I'm phoning on behalf of my husband, really. In the past, he's had a lot of back trouble, which we class as sciatica. That's never really been diagnosed officially, because it's one of those things that comes and goes. But we've noticed in the last 18 months, his right foot is quite numb. And if you tread on it, he can't feel it. Could this be coming from the back?
Yes. Yes, and again, similar to the last caller, it sounds like there's nerve involvement there. Well, without hesitation, I would say it's the nerve involvement, because numbness has to be that a nerve isn't sending signals effectively back up to the spinal cord. So somewhere, I would say that there's a nerve getting slightly compressed.
And I mean, his numbness is permanent, but his back trouble is not permanent.
But does he go and has he been to see a doctor?
Yes, she has, and he just said, oh, it's coming from your back. And, of course, you know what men are. They don't pursue anything. They're glad to get out the surgery.
Yeah. Does he suffer from anything else?
No. He's 83 and all he's on is 1 aspirin a day. Nothing else. He's very, very healthy, really.
And is it the whole foot?
Yes.
I'd probably follow that up, to be fair. I think.
Yes.
What would you just refer?
Yeah, I'd go back to the GP or maybe another GP and get a second opinion, probably on that.
I see. Okay, thank you for your time.
Okay.
Yeah.
Okay, Jane, thank you. Taking your calls on 08453 009956. 08453 009956. We all tend to scoff at health and safety advice, but when it comes to lifting, gentlemen, lifting something correctly, are there ways to lift things and ways not to lift things?
Yeah, certainly. In the lower back we have a curve, a forward curve, which is called a lordosis, and it's important to try to keep that curve when you do lifting. So not to bend from the hips and straighten your spine, but to bend from your knees so you can maintain that curve. Then the disc load goes through the weight load goes through the discs rather than on the facet joints, which are at the back. So lifting is an important thing. Just when you talk about lifting, what we found, just a little bit of a hint for some folks doing gardening, we often find at this time of year, people who've been sedentary through the winter get out into the garden lifting bags of fertilizer and going really going hard at it. Our advice always to people going for gardening is to maybe take 3 or 4 tasks and split the time, maybe 10 to 15 minutes on one task, and then stop and go to another task, a different task. Because we found that doing sustained, prolonged, repetitive